Hello, this is Dr. Lewerenz here at Longevity Health Institute. Hope this finds you well, as I always say, and informs you and makes you even better. Or you share with others, and this message can help friends, family, and loved ones, right? So good stuff. So I'm here in my office here on a Tuesday at the end of my day. I made a list here of some things because I thought, hey, what's the best thing? Because I get this question asked a lot still after all these years is, do you treat, can you fix this, or how do you look at this, or am I able to see you for this? And me and my practitioners do a lot of, break it down. Yeah, it's very functional, personalized medicine. Probably the most important part is personalized, but we break it down so that really any internal medicine, primary care, general medical need, we do address in our model that I created. So long story short is I wanted to share with you cases today that I talked about and I saw patients and how they're doing and why I saw them, so that you can get a grasp of all the kind of variety of cases and situations that we deal with here. But also I want to share one common theme, and I think there's about 8 or 10 cases here that I'm going to briefly hit upon, and there's one very common theme in just one day here at Longevity Health Institute. So one of my first patients was, they had been experiencing a lot of in the evening palpitations. Now, this is a younger gentleman, and he literally said that, man, what's going on, doc? I think he's about 38, and he said, I'm getting it in the evening. I feel this, I'm watching TV or I'm on my computer, I'm trying to relax or decompress, and I'm getting a little bit of a thump in my chest or a weird, funny feeling in my chest. Now, we always do our diligence and check people out to a very detailed manner to rule out the bad stuff. Rule out the bad stuff, do no harm, but what is very common and likely happening, and I know this gentleman well, seen him for a few years, and in many other ways he's healthy, a few little things, but this is something that's very common, and it's actually related to some of my other cases today. But one interesting thing that happens when we have chronic stress or have a lot going on our plate, I call it plate spinning. You got a lot going on, not necessarily always bad stuff, but just busy, and not enough time for balance, okay? Is our autonomic nervous system and our adrenal response system gets taxed. And what happens is we get this diurnal pattern of stress response still going on in an inappropriate time in the evening. So we're trying to wind down, but our adrenal gland has been so spiking all over the place throughout the day for maybe months, or who knows, maybe even a year or so. Now just because your body is exhausted and you sit down, does not mean that adrenal gland and that receptor, you've heard me talk in other videos about that hormone receptor that we have, is going to match, if you will. And so your adrenal gland is on, if you will, still kind of an engine, hyper overdrive, yet your body is exhausted, and those two things don't meet and match. And we can really exacerbate what are called PVCs, premature ventricular contractions, or PACs, premature atrial contractions. Basically, it's the heart getting a little extra beat, getting a little extra thump. And when you're adrenally exhausted and tired in the evening, you're going to feel it. So instead of your heart, we don't notice our heart beating every day and rhythmically and all that. So instead, what happens is that you go to relax in that, and maybe you're laying down on the couch watching TV or whatever, and you feel a little bit extra. Now, this should not go on for minutes or even many seconds, but if you feel it for a second or two, it's very common. He had that. The next patient I actually had was, what's most important here is why this happened, but great weight loss results. Now this gentleman, man, he's dialed in. I love this guy. He literally, man, if I tell him, do this, do that, do this, he's very committed, starts a plan, follows through. Love that kind of compliance with the patient, because we can really get things I can't do is I can guide you and tell you, and here at Longevity, we always are going to give you that approach to our 6-point model and put you in the right direction, but you got to do it. And this guy really did it. Now, long story short with him, he's lost 44 pounds. He, a little fatigued, a little anxiety, in that we resolved fairly quickly, but in less than a year, he's lost 44 pounds with just detoxing, getting his liver right, getting his diet dialed in, balancing his hormones, because he had a little bit of a thyroid and testosterone issue, and he's doing lovely. I mean, he literally, I think he used that word actually. He's a very articulate man that is actually a therapist, and he's like, I'm doing amazing, feel great, energy great, able to handle life and stressors, and he's down 44 pounds. So that's awesome. Another patient of mine, has some mild underlying coronary artery disease. He actually has a stent. This is, again, a different patient, third patient I'm talking about. And all of a sudden now he's spiking blood pressure. So he didn't normally have blood pressure that was giving him any trouble. And he was on a beta blocker low dose because that preserves heart function. Basically, in cardiology, if we slow down your heart, the studies show that you'll have less coronary artery disease. It's true, not always the greatest idea with everybody, because when you slow down the heart, you're slowing down everything. But that's a long discussion, right or wrong. But the point is that in this gentleman, he was getting these big spikes. I mean, even blood pressure 160 over 110, really feeling okay. But he, wonder what the heck's going on. We had some communication last week, low salt, de-stressing, good sleep, add some magnesium. It didn't work, or not enough. So I put him on, at that time, a added blood pressure pill, lisinopril, and added beet extract supplement. We have a great nitric oxide beet extract supplement, helps control blood pressure when it's you're just needing to drop it 3 to 5 points, and not have to have some big, strong, robust response of a blood pressure medicine. And so we added those, but adding that little bit of another blood pressure pill called lisinopril was helping out. But the whole question he was asking was why? Well, he's going to talk to his cardiologist. He has a good cardiologist. He's going to get into the nitty gritty with that. But he had a lot of stuff going on lately, a lot of stress, a lot of work activity, travel, things like this. And he also was experiencing a little bit of pain, and the pain was coming from exercise. And long story short with him, I think between the sodium, the stress, the travel, having underlying coronary artery disease, he's getting these spikes of blood pressure. Now, in the past, we saw this. We do a central blood pressure here that looks at cardiac and vascular elasticity, and his central pressures were a little bit high, and we were watching those. He's going to come in this week to get another central blood pressure, which is the most accurate blood pressure test you can get done, versus just your regular brachial test that you do at home or at, the CVS or with the automated ones. But, I think some people are very sensitive to salt and pain and stress, and that's causing this spike. The next patient was a new patient. I don't have all the answers to him yet, but about a 55, 60-year-old gentleman, new patient with pulmonary fibrosis. His wife is a patient and sent him in. I said, sorry. Sorry, but not sorry, right? No, but he wants to feel better because he has also some chronic pain and arthritis. He's had a couple knee replacements, but he's got hip and shoulder pain. He's really sick of living in this chronic arthritis. And other than the pulmonary fibrosis, he's very healthy. He was fatigued though, and a lot of his fatigue and pain is just really wearing him down. He just recently retired. He's a retired firefighter. Interesting, right? Well, I'll tell you, pulmonary fibrosis, which my mother has, sadly, and I help manage that with her. She's 80. Long story short, pulmonary fibrosis comes from toxic exposure, to the cilia and the mucosal lining of the alveoli in your lung, period. Hands down, no argument. You hear anything different or people telling you anything different, it's not true. Yes, there is autoimmune pulmonary fibrosis, but 90% of pulmonary fibrosis is from toxic exposure. this gentleman being a firefighter and having all the inhalants and stuff that he's been exposed to. And then as we talked today and got to know each other, he said literally, once the fire is out, we wanted to get the mask off back then, 20 years ago, 15 years ago, 30 years ago. Why? He's like, because literally you felt like you couldn't breathe, and having any, that off your face made it feel better. Yet the worst part of the toxins and the inhalants and that in the air are after the fire is out. And he's aware of that now, but we're gonna do some nice things with him. I think he's got some adrenal issues. He's got some digestive and nutrient issues. The one thing I wanna mention about his pulmonary fibrosis is that we use a lot of glutathione, IV glutathione and nebulized inhaled glutathione, which has an effect on improving, not reversing completely, because it is a chronic and progressive disease where people's lungs are hardened and don't move, so their oxygen drops. They have very difficulty breathing, but we actually can make improvements on nebulizing and using glutathione, as I do with my mother. The next patient called me. He was a concierge patient of mine, and he called me in dire concern because he just wanted to say, hey, doc, I want to pump the brakes, talk to you. I know I do good wellness preventative stuff with you, but let's review my stories and what you found out about me, and am I doing enough? 2 of his friends in the last month have died, one of them under 50 and one of them 52, and both were from sudden cardiac events. You've heard me do videos and talk about patients I have here, even somebody I got to know well, even hands-on with his pulmonary cardiac arrest. But this gentleman called me because he's concerned. Now, the biggest thing is this. Why do we do cardiac calcium scores and cardiac screening with everybody 35, 40 and over? Why? Because yes, maybe it's the outliers, but a lot of people can be highly functional, but have underlying coronary artery disease and have all these other things in our systems approach that you've heard me talk about in videos here on YouTube and Facebook and that when these are off, it's like a cascading event that starts to happen. And if you have that underlying disease going on, all it takes is a flick, of plaque, what we call unstable plaque. And when you have inflammation or high blood pressure or there's a stressor or whatever, and what happens? Boom, you go into cardiac arrest. You've heard me talk about that before. This gentleman, we got him covered. He's going to get some new labs, new follow-up and all that. He was just highly worried. I'm like, you're in the right spot, getting the right tests and questions done and answered. But that's scary because, again, under 50 or near 50, suddenly dying is very scary. In fact, one of them, he said, the younger gentleman under 50, I think he was 47 or 48, actually had many kids. So very, very, very sad. I did see another patient that mentioned, by the way, that chest palpitation. Excuse me, take a drink of my tea. And that chest palpitation, that symptom from stress and adrenal stuff. And that's very common. Another patient I saw later in the afternoon, which was really interesting because this patient had mono, a younger lady, had mono in about a year ago, roughly. I'm estimating roughly 10 months to a year ago. Got over the mono. We did IV vitamin C's and some IV antioxidant therapies, plus a good oral regimen of things to help boost the adrenal system and the immune system and fight that virus. And pretty much for all means did well for, after a couple months. And mono can obviously be debilitating for several months to even longer than that. But what's happened then is this April 2021, she actually developed COVID and got through that pretty well with our help, but run down, sinus congestion, fever, things like that for a week or two. But since then has been chronically getting a cough or a cold or a sore throat or a real rundown in that. What happened is, and there's study and literature out about this, is that a lot of patients post-COVID are developing a reactivation of Epstein Barr or mono. So you're getting this long haul COVID, but also Epstein Barr mono flare. And she's been experiencing this. Her antibodies for Epstein Barr, we got the labs back today, were very high. Her inflammatory markers were very high. And she had the highest antibodies in her blood, okay, that I've ever seen in our office post-COVID. And she had COVID back in April, okay, and here we're in November of 2021. So again, this is somebody that we have to really still attack from an immune building standpoint, a diet building standpoint, a de-stressing. And the stress part is real because even though this is a younger individual in her late teens, okay, this is an individual that, you know, stays up late, might not eat great, has a lot of stress at school and, you know, friends and social media and all that stuff, all those pull dynamics. But also, this is somebody that really, you know, needs that, if you will, physiologic de-stressing, meaning better sleep habits, good nutrition supplementation. We're going to do IV vitamins and antioxidant IVs with her, okay? And she will do well. But, you know, this long haul post-COVID flare of mono is pretty common. There's many literature studies out there about this, and we've seen it here. This person, though, actually is pretty significant because the levels in the blood look severe. We'll track that month by month, and she'll do fine. But that is, it was pretty, tell you what, it was pretty shocking to see those numbers and those levels. Anytime we see an inflammatory number, a CRP, in the 40s, and in a COVID antibody over 2,500, that is essentially 6-7 months later. Wow, that's impressive. I saw another patient that was new that actually had some significant brain fog and fatigue just for the last 3-4 months. And really that was very evident after, you know, getting a thorough interview and spent about 45 minutes to an hour and reviewing a lot of things and looking at a lot of things that we do in the office. She's going to end up being, remember, she's new, I have no results, but an adrenal patient. Too much stress for too many years with a job and a relationship, and now she's got the effects of, you know, stress, chronic stress. And one of the reasons I say that pretty confidently is that she has low blood pressure. She has, you know, lightheaded dizziness. A common term with hypoadrenalism or adrenal fatigue is brain fog. She had a lot of brain fog, she said, and, you know, just not feeling great like herself. And so we'll get the numbers and test her and fix her adrenals, but she was pretty evident. Another patient I saw, another wonderful patient, this was a female versus the other weight loss that was a male, 42-pound weight loss and increased energy, same kind of model. Now, this lady not only had the weight to lose, but had a little bit of fatty liver. And we did very specific protocols to get rid of and reverse fatty liver, because remember in other videos about weight loss I have, when you improve your liver metabolism and you improve methylation and detoxification, you can increase your metabolic rate, meaning calories burned, about 25 to 30%. And that's pretty impressive. And you add all many other things up we do, it's how you can get to a 42-pound weight loss. I got another gentleman that just came in a few weeks after COVID doing better, but now has a flare of his cough again. And that can be common, you know, I think just because you got to get recovered post-COVID. COVID hits many systems. Yeah, I've seen it here, hit your adrenal gland, hit your brain, hit, you know, your blood thickening. So you're inside your arteries are getting that, I'm going to talk about this in another video. It's knocking out your ACE2 receptor, so your blood gets thicker. You know, we've seen people get higher blood pressure when they've been post-COVID, even months later. But you got to do a lot of, even though you feel better in 2 weeks and you're past your quarantine, you really got to do a lot of supportive things so you don't have this lingering or recurrent. There is some theory out there and some physiologic evidence, and I will tell you here at Longevity Health Institute, I believe this too, because we're already seeing it, is we're almost, going into 2 years of this pandemic and COVID-19, and I will tell you 100%, hands down, okay, we're going to see a lot more chronic illnesses and chronic diseases in the years to come because of COVID. Whether you feel good or reasonably good or not after your COVID infection, you have to do a lot of supportive things post-COVID to make sure that you're back to wellness and optimal health, okay? Which to me means you need to look at labs and you look at details in somebody's personal health. The last patient I just want to mention, he had a lot going on about a year ago. He came to us after he had been an alcohol use abuser for years and had an esophageal stricture and then varicoceles, where it's essentially varicose veins of your esophagus that comes from liver stress and portal hypertension and things that happen due to too much alcohol over years. Anyway, and he ended up literally having an esophageal rupture, which is just nothing but a nightmare to go through, and even for hospitals and doctors to deal with, because it's very messy and very hard to heal, and just a horrible thing for the patient. All around, it's horrible. Well, this was over a year ago. Obviously, he had surgery and a lot of gastro work and specialists working with him. When he came to us, he needed to essentially wanted to feel getting some overall approach and improvement in health, energy, feel good, put me back together, if you will. He had some other things going on in the past, nothing major. We discovered though that he had a lot of inflammation in him. He had a very high homocysteine level, which thickens your blood and makes a cardiac risk. He had very low testosterone. He basically was on that fine line of depression and apathy in his life. And it came down to a few things that were very evident, and why, and I firmly believe this, it got improved with him, got him through the healing of about 6 months or a year of this esophageal rupture and varicoceles and all that, and he's doing wonderful now in all terms. I spoke with him tonight. By the way, in 1 year post rupture, his EGD, which is almost unheard of, his scope, his esophagus in a year looks amazing. No varicoceles, no evidence of any further strictures, no ulcerations and inflammation. So he's doing wonderful. We use a lot of natural things besides what the specialists and gastroenterologists used. But anyway, he had low testosterone, high homocysteine, bad diet, and a lot of inflammation. Well, all his numbers look lovely now, look wonderful, back to optimal, not just normal, and he's feeling good, his energy's good and all that, with some testosterone replacement, some supplementation to help lower homocysteine, some dietary changes that help not just heal the lining of the esophagus and the gut, okay? And obviously, truth be told, he didn't stop drinking. I wish he would have, and I'm coaching him through that, but he's way, way less than he ever was. And at times he does have long terms and bits here of sobriety. So, good for him, and proud of him. And that was a lot of work for him to do, to get through that last year. So that's some stories here at Longevity Health Institute. What's one of the common denominators? If you paid attention, stress. Remember, the take-home message here is this. Stress comes in many forms. It's not just bad stuff. It can be too much of something. It can be physiologic, physical, emotional, spiritual, psychological. You have more conversations, remember, in your brain to yourself in that rumination than you do in the world in your day, okay? It's actually about 90% to 10, okay? Believe it or not, most people. 10% come out of your mouth and with other individuals. 90% are your thoughts and your emotions and stuff. But remember, these are all stressors, and stressors can really affect the body in so many ways here. I mean, high blood pressure, fatigue, brain fog, chest palpitations, immune effects, potentially, I'm going to say this, potentially driving people because of stress to drink more alcohol. Okay, so remember, one of the take-home messages here, we have to always recognize stress, pivot to a healthier lifestyle, or see somebody, whether it's a medical doctor, a functional personalized doctor like myself, or like our practice here, my practitioners here would love to see and help you out. But you have to appreciate and not ignore or just patchwork your stress in your life, okay? Because it will show up in ugly ways. So hopefully this was educational, insightful, maybe entertaining. Anyway, this is Dr. Lewerenz. Be well, always accepting new patients here. Me and my practitioners bringing you the best in functional personalized medicine. Be well.